Hello everyone, I hope and I believe you all are doing great. Now let's study about the esophageal disorders. From this, mark my words, you will be getting a short note. It is a super important topic. Just try to give this topic at least, let's just give this topic 3 stars, okay? Let's study. So esophagus is a muscular tube we have seen in the part 1 also. It is a muscular tube that transports the food from the pharynx to the stomach. Then you have esophageal disorders that involves your structural, motility or mucosal abnormalities that mainly affects your swallowing and digestion. If I talk about the classification, so the esophageal disorders are classified into either based on their motility, based on their inflammation, that is inflammatory, and on the structural. So they are classified as MIS. Okay. In the motility one, I have 𝗝𝗵𝗵𝗵𝗺 and I have diffuse esophageal spasm. In the inflammatory one, I have I and R, that is reflux esophagitis and infectious esophagitis. In the structural one, I have esophageal varices, esophageal carcinoma, and strictures and diverticulitis. Let's study about the 𝗝𝗵𝗵𝗵𝗺. So 𝗝𝗵𝗵𝗵𝗵𝗵 it is what it is. There is a failure of relaxation of your lower esophageal sphincter which results in loss of peristalsis. See, this is your lower esophageal sphincter. It fails to relax, as a result of which there is a loss of peristalsis. If I talk about the pathogenesis, there is a loss of orbex flaxes of neurons that are present over there. The clinical features will be, there will be progressive dysphagia, more to solids than liquid, regurgitation of food, chest pain and weight loss. In the investigations, I will do the barium swallow. There I will be able to appreciate a very classical image of 𝗝𝗵𝗵𝗵𝗺, that is your bird beak appearance. In the treatment, what I will give balloon dilatation, then Heller's myotomy and botulinum toxin injection. So botulinum toxin injections are also given to the patients who just want to get rid of their wrinkles. Next you have is the gastroesophageal reflux disease. So it is a reflux of gastric content into the esophagus causing the mucosal injury. What is the etiology? There is decreased lower esophageal and sphincter tone. Okay, there will be hiatus hernia, there can be obesity, pregnancy and smoking. This can be the risk factors. What are the clinical features? There can be heartburn, regurgitation and dysphagia. See this figure, you are able to see that all the acid that was there in the stomach is going up. Okay, what are the complications? The complications, there can be adenocarcinoma, Barrett esophagus and esophagitis. What is the treatment? Just ask the patient for the lifestyle modification, proton pumps inhibitor. If required, the patient has to undergo a surgery by the name of fundoplication. Then you have the esophagitis. What are the types you have? You have the reflux esophagitis, infectious, drug-induced and eosinophilic esophagitis. In the infectious one, you have the candida, and we have seen that candida infection mainly occurs in the immunocompromised patients. What are the symptoms? You have adenocarcinoma, dysphagia, retrosternal pain. Diagnosis is made via the endoscopy and biopsy, and treatment is to treat the underlying cause, and the antifungals and antivirals are given. Next you have the esophageal varices. So esophageal varices is the dilated, see this veins you are able to see, these are nothing but the dilated submucosal veins. These are the dilated submucosal veins. What are the causes? In the causes you have cirrhosis and portal venous thrombosis. Then what are the clinical features? There can be hematemesis, melena and signs of chronic liver disease. How will I manage this patient? For the management, I have to give them beta blockers, and for the surgery you have a TIPS surgery for that you need to give, or you can give the patient liver transplant. Next you have is the esophageal carcinoma. So in the esophageal carcinoma, I have mainly two types. What are the two types I have? The squamous cell carcinoma and the adenocarcinoma. What are the risk factors I have? Smoking, alcohol and chronic reflux. What are the clinical features? There can be progressive dysphagia, weight loss, odynophagia and hoarseness of voice. In the investigation, I will order endoscopy, biopsy and barium swallow. In the treatment, I'll give the patient surgery radiotherapy and chemotherapy. What are the investigations in esophageal disorder? First thing is the barium swallow study. See, this X-ray you are able to see. This is how a barium swallow is done. There is a liquid and we give that liquid to the patient and ask them to drink, and then when the patient goes for an X-ray, we are able to see that where the defect is there. Okay, then you can do the upper GI endoscopy, esophageal manometry, 24 hours, pH monitoring and biopsy of histopathology. What is the summary? Esophageal disorders can be divided into based on their motility, inflammatory or structural in nature. Common symptoms are dysphagia, heartburn, regurgitation and chest pain. Diagnosis made by the endoscopy and barium studies. So this you need to keep in mind. See, either a disorder will be asked or you can ask that write a short note on the common disorders of your esophagus. So study this topic in that perspective only. I hope and I believe I made this lecture very clear to you. If you have any doubt, please feel free to ask me. Thank you.